It is 8/14. March is Colorectal Cancer Awareness Month, and this year, more than 145,000 people are expected to be diagnosed. So Dr. Sanjay Reddy is here to help us better understand this disease. Thanks so much for coming in.
Thanks for having me, Jasmine.
That number was really shocking. 145,000?
Yeah, and actually 50,000 men and women are expected to pass away from colon cancer in 2019. So it's a pretty staggering statistic, and a lot of people don't realize it.
Really common.
It's an extremely common cancer. In fact, 1 out of 22 Americans are expected to be diagnosed with colon or rectal cancer during their lifetime. So it's a very common cancer. It's the #2 cause of cancer death in this country among men and women, in fact.
So let's talk about the impacts on the body. Like what happens here?
Well, the interesting thing is we used to be sort of programmed to look for colon cancer in patients who presented to us in their physician's office with symptoms, pain, bleeding, weight loss, things like that, things that caught the patient's attention and then would lead to medical evaluation. Now really we're shifting to a focus on wellness and prevention, so trying to find evidence of precancerous lesions or polyps before they cause symptoms, and that's really the benefit of screening, certainly this month and every month.
Okay, so yes, screening this month since it's Awareness Month. How many times what's your suggestion?
Well, recently we've updated our guidance from the American Cancer Society to start screening at the age of 45.
Okay.
Traditionally, we've started at the age of 50 up until the mid-70s, and for a person at what we call average risk, who doesn't have a close family member with colon or rectal cancer, we typically would say screen every 10 years, depending on the type of test and the quality of the testing done. In regards to colonoscopy, which is the gold standard test, there are a variety of available and accessible tests for colon cancer that all have benefit, but in terms of colonoscopy, we typically say once every 10 years.
Okay. Are there certain people who are more at risk?
Absolutely. That's a great question, Jasmine. So patients who have close family members with colon or rectal cancer, so a parent or sibling, or with certain types of genetic predisposition are in fact at increased risk. That makes up, genetic risk makes up only about 5% of diagnosis of colon cancer. So the vast majority of patients that we unfortunately diagnose with colon or rectal cancer actually don't have increased risk. So in patients with increased risk factors, it's very important to talk to a physician and find out when you should get screened earlier than 45 in many cases if you're at increased risk. But for most of us at average risk who don't have close family with colon or rectal cancer diagnoses, age 45 is an adequate time to start.
That's interesting that you mentioned that, because sometimes families don't like to talk about their medical histories, but maybe you need to talk.
Absolutely, and I think that's a really great point and a great suggestion this month and every month. In March is a great time to talk to your family about your family history. Talk to family members because, if your parent or sibling has a diagnosis, it certainly puts you at increased risk, and that applies to many types of cancer. So whether it's breast cancer or prostate cancer or colon cancer, a comfortable, frank discussion about family history is really important, and you can save the life of a loved one by having that conversation.
That's a really good point. All right. Thank you so much, Dr. Sanjay, for coming in.
Pleasure to be here. Thanks so much for having me, and thanks for giving us the time to talk about this really important message.
No problem. We're going to send things over to Amy.